Live
What's
on
the,
Facebook.
what's the best one to go on?
Live on Instagram.
Where do you want?
Facebook and Instagram.
Be careful,
are the
honey.
two best ones. Which one, you'll be on Instagram?
I'll be on Instagram.
And
All right, I'm going live on TikTok right now.
Facebook and TikTok.
All right. Oh, my shirt, my golf shirt, all good.
Okay, Instagram, Facebook.
All right, are we live?
Yes. we're all
Thank you,
live on-
Justin. All right, today we have a wonderful question and answer. We have Dr. Allen, we have Trinity, we have Christy. Hunter's off today, so you won't hear Hunter's voice. Justin got all the cameras up and good to go. Hi TikTok, hi Instagram, all that. I know we're on all 6 platforms right now, which is fantastic. And once again, today is December 9th, correct, guys?
Yep.
The herb of the day is California poppy. Now, you guys have heard me talk about California poppy a lot. So let me say this again, just because I always like to repeat things I say on a regular basis so it burns into your memory. When I can honestly tell you, 26 years, the 2 most recommended things I've ever given out in care was Albizia, which we are coming to Albizia on the Christmas days, and also California poppy. Now, there is a clinical reason why. We're going to cover California poppy today, but Albizia was by far dominant number 1. And I'll just say it was dominant due to the fact that there is a correlation between the effects of Benadryl and the effects of Albizia, which made it very common to use it, due to the fact that people have a lot of inflammatory high histamine reactions. That being said, poppy was number 2 because of what we're going to talk about today. Okay, California poppy is a very, very widely known herb. It grows in both North America and South America. It is the flower of California. That's why it's called California poppy. But remember, I want to always remember this. Whenever I actually give you the purpose of it, there is some bioactive compound that has some clinical benefit. And with a nice thing about California poppy, very little to no side effects that they know of. Can't say there won't be. More people that use it, sometimes there could be. You could be reactive to anything. I remember this, being a person that is so privy to allergies, as far as like understanding them and what goes on, you can basically be allergic to anything. You really can. Okay, so I'll never say that someone can't be allergic to something. I believe you can be allergic to salad and stuff. But there's a couple of major compounds that exist within California poppy. Number 1, there's 2 alkaloids that I really like. Now, once again, alkaloids are nitrogen-based compounds, and it's californiadine. Californiadine. I know it's really weird saying it, and protopine. Okay, these things contribute to the sedative and analgesic effect. Okay, so once again, there's also a bunch of flavonoids and carotenoids in there. So the main bioactive compound is actually alkaloids, californiadine and protopine. Now remember, so we're going to go over the 4 things that it's really known for. It's known for a great sleep aid, for the quality of sleep. So therefore, there's some things that are sedative that help you go to sleep. California poppy is more than that. Okay, it's really known for anxiety and stress relief. There's been documentation of relieving anxiety and tension, but also the one thing about California poppy compared to the other anti-anxiety type of herbs, really good at pain management. Let me say it again, pain management. So California exhibits, a mild analgesic effect. It's been known for headaches, muscle pain, and other discomforts. Okay. Now, once again, digestive support. It's really good at relieving abdominal discomfort. So a lot of people have that from even just having mild anxiety or even major anxiety. So therefore, if we look at the sleep aid, there's an anxiety and stress relief effect, there's pain management, and there's also a digestive support on there. So California poppy has some wonderful properties that have been documented. There's been some rat studies. There's been a couple clinical trials for humans, but a lot of animal studies, obviously, because I'm hoping now with MAHA that there's going to be some resources going to study more herbs on humans. There's a lot of animal studies with herbs just because it's much easier and cheaper and more cost effective and faster to do. Just that obviously I like human trials a little bit better. I'm not saying that negates any animal trial than drugs either, because I know a lot of people in the natural world try to say that, well, we're not rats, so studying drugs on rats. Well, there's still properties that you can study. I believe that study everything. Study monkeys, study humans, study rats, study birds. I don't give a crap what it does. It's like there's still an effect that it does have, okay? No, once again, I believe that, California poppy, from some side effects, you could be allergic to it that way. Nobody really knows. It doesn't really talk about it generally. Is that they don't really document many things happen in time. I'm an hour. Now you can go to the Wellness Way website and go to a discount for it right now. Every herb that we talk about through the course of the 12 days of Christmas, you can get a discount on it, and you can go to thewellnessway.com, go to supplements. I encourage you more to go to the clinics and go for there and see over there. So that being said, we have Dr. Allen, we have Christy, we have Trinity going through the question stuff that way. I'm just going through the TikTok stuff here right now. All right, guys, what do we have questions? Where are we starting? What do we got today?
How do you tell if you have high acid?
How do you tell if you have high or low stomach acid? It's difficult. It really is. Because here's what happens. Even if you scoped somebody, some of the stomach acid could be deficient or be out or not even in the digestive process that way. There is a little test that you can do where it's a pill on a string, and really the capsule dissolves and you have a acidic strip in there. It's very difficult to tell how much stomach acid you have and if you're deficient or excess. I always tell people this. Something that's fairly accurate is take some betaine hydrochloride, and if it doesn't burn, take more. If it doesn't burn, take more. And I've had people take 20 pills before each meal and still not burn. And I've had a person take 2 pills and burn. So therefore, once again, you can actually kind of put stomach acid within your stomach by doing betaine hydrochloride. And if it burns, you could have. If it's deficient, you could take a ton of pills and still not burn until you get to an excess amount.
How to get my sugar levels down fast?
How to get your sugar levels down fast?
I find it spikes very easily.
I find it spikes very easily. Spiking, I know there's a lot of TikTok videos and videos going around and talking about insulin spikes and blood sugar spikes. Just let me tell you this. Things are supposed to spike. If I jump up really quickly that way right now, just to move around, my blood pressure is going to spike up for a second. If I eat something, my stomach acid is going to spike up if there's protein in there to sterilize and break amino acids down to amino acids and everything. So therefore, here's what happens. What I want you to do is try to reduce your intake. Try to do more carnivore-ish with lots of fiber. I do like lots of fiber. I'm gonna have a beef stick here pretty soon. Costco has some great ones. They're very cost effective, some grass-fed beef sticks. So really what you want to do is try not to have a high glycemic food right away. Put protein in your system right away first. I would encourage you to do protein, but you're still gonna have some blood sugar spike and still gonna have some insulin spike just by having those good things. So we have to understand that it's more about high glucose levels for a high long period, high insulin levels for a high long time period that becomes bad. We have to understand that they spike just for adaptation. They spike just to you get through a meal and how quickly it goes down. So that's why one girl that's selling this reduce your insulin sugar supplement or something like that. I'm cautious of that because I want my insulin to spike up after I have a meal. I want my sugar to jump up. It's supposed to. It's why when you do blood work, you have to fast before, because if all of a sudden you ate an hour or two before, your blood glucose levels are going to be abnormal. They're not going to be based on the levels that they're there. So is carnivore okay for postmenopausal women? Thank you very much, Hope, for that question. I will answer it this way. I'd like to see women, especially in postmenopausal realms, get a significant amount of protein, and both sarcopenia, which is muscle loss, atrophy. So I want to make sure that you have enough protein. I want you to focus on protein first, but Hope, understand this. I want to make sure that you always have fiber. I'm a big sauerkraut person. I had the interns over this weekend. Dr. Allen is who's doing questions right now. He came over and took a big old scoop of the sauerkraut from a house and everything, in the kitchen, all the interns. It's like, I need that fiber. I want that vitamin C. I want the fermentation that happens. Are you going to benefit if you go carnivore-ish or even just carnivore for 2 weeks? I would say yes, Hope, you would, because you would really have reduced the highly processed, which is about 73% of our diets, from what I understood from the average American right now, which I understand because it's cheaper food. So would you see a benefit if you did it for a couple weeks? I would just like you to make sure that if you did it just straight for 2 weeks, don't go over that 2 weeks, and start to add some fiber-based things into your diet that way, and even some fruit. Here we go. I got another question from TikTok. DA said the question: 2 miscarriages at 5 weeks. Could a parasite cause this? I'm so frustrated 5 years into. D, first of all, very sorry about the miscarriages. It's very emotional. Couple good things, D. One of the most difficult things is to fertilize the egg and implant on. You're having that done. That's awesome. That's great. That's some of the most difficult things in fertility. But what is happening though is this: either you suffer from an autoimmune condition, or your progesterone is not sufficient enough to be able to maintain it. And here's what happens: this. Could a parasite cause autoimmune? Absolutely. Could a parasite cause an infection that can lead to a drain of your progesterone? Absolutely. Is it the only factor that's going to lead you just to miscarriage twice before the 5-week period? I don't believe so. I believe it can be a contributing factor. I believe there's going to be a little bit more severe things going on. Not that I'm going to downplay the severity of any overgrowth of parasites, because that could be very negative to the immune response. But I would look at the reason why it's lost is because there is major progesterone deficiencies. And I have no problem even if you just did some bioidentical progesterone once you find that you get pregnant, to maintain it. And then you can work on the things to reduce the inflammatory things. And the parasites could be the inflammatory thing that causes such a high immune response that it negates some of the normal hormonal balance you need to maintain that pregnancy. So very sorry also, D, for you losing 2 beautiful children in the course of 5 weeks each time.
We actually have a couple questions from YouTube now.
We have a couple questions on YouTube. Okay, once again, thank you, YouTube.
6 months postpartum.
6 months postpartum.
And just now experiencing hair loss.
Just now experiencing hair loss.
Still breastfeeding.
Still breastfeeding.
What can I do?
First of all, number one, God bless you, first of all, that you are still breastfeeding 6 months. That's what I say right there. God bless you. You're amazing. You're an amazing mom. You're sacrificing your body. And I am such a big fan of moms that breastfeed for a long period of time. Now, I'm not saying that every mom has to do it. I know there's circumstances that way. First of all, thank you. But also draining your body, so you have to make sure that you have sufficient nutrients first. Make sure, let's get back to the protein aspect. And actually, believe it or not, you need a little bit of fat and sugar. So therefore, supplementation-wise, vitamin D is so essential, so essential. Increase your protein. Try to get at least 120 to 140 grams of protein per day. Try to supplement with vitamin D. I don't know what your blood levels are at, so I can't give you the exact amount, but I can honestly tell you, that you're going to look at the factors of being deficient, because milk production, you're going to use up a lot of your vitamin D. I would also look at taking some form of cod liver oil, because you do need some significant omega-3s to keep your breast milk production and not lose your tissue as far as hair and other things that way. So therefore, increase your protein intake, watch vitamin D like crazy, cod liver oil, and then I want to know, did you pretty much lose most of your baby fat that you got from it that way? That would be nice to know too, a little bit more in depth. Okay? What's the next question?
Are fermented products okay for those dealing with yeast and candida issues?
Are fermented products okay for people that suffer from yeast and candida issues? Believe it or not, you could actually even feel a little bit bloated after eating a fermented product, because just more bacteria, having to battle with more bacteria. If you're dealing with yeast and other candida problems, you really do have to kind of go carnivore-ish, and even avoid, I hate to say this, but watch out for fiber, because you can produce some gas from it that way. But go carnivore and really acidify your stomach with 18 hydrochloride, because that's going to set up a whole process from your stomach for sterilization. It's going to move into small intestine. You're going to get high bile release. You're going to also have biles very antiseptic. So therefore, by really bringing that up, you're going to really change the whole microflora of your small and large intestine, And by staying away from sugar, you're gonna kind of, a little bit starve some of that overgrowth, and it will be very beneficial if you do that for a time and then add them back in slowly, because I'm still the biggest fan of fermented products. I think that fermented. There are times, once again, there can be a little bit of an effect that is not as desirable because you're just bacteria fighting bacteria. And if you're suffering with a lot of candida and yeast overgrowth, I want you to look into what we have called CY complex. There's a bacteria called S. boulardii. Just do some basic microbial research. S. boulardii is a yeast that combats yeast. So it's S. boulardii, Saccharomyces boulardii, but just type in S. boulardii, and you'd be like, oh my goodness, why is it that women that have yeast infections or overgrowth are not taking this on a regular basis? It's a very thing I use clinically for 26 years. Great questions, though. What's next?
Look over here. I got a
Facebook,
question.
okay.
I've got a question about glaucoma.
Glaucoma.
She's asking for suggestions. She says they want her to take drops for the rest of her life.
Well, they do want to take drugs, okay, for glaucoma. Now, once again, there's some very negative things that happen if you do not do something about glaucoma. You're going to probably end up losing your sight, okay? Now, of course, they're going to go for the medication. Let's just say, I got to be careful on saying this because I think this is the next biggest thing next to the shots if you talk about the kind of censor you. But there's a reason why they're in a lot of states. There's this little gummies that are not illegal in certain states that you could probably go and actually help with some relief that way. Now, long term, is that going to fix your eye problem? No. You have a blood sugar problem. You need to start taking some cod liver oil. You need to take some bacopa. You need to take and fix some of the neurological. Because remember, the optic nerve is nothing more than the nerve that's sensitive to light. It's an extension of your brain. So there's neurological problems that are leading to it. There's drainage problems that are leading to the factor. So I see a lot of blood sugar problems. Glaucoma and blood sugar problems kind of go hand in hand.
Awesome.
What's next?
Next one, I got a lady asking how she can raise her cholesterol.
Well, remember, it depends on what she's doing, because by consuming, a certain amount of fats, it only changes your lipid panel by a little bit. I'd be more concerned that there might be a problem with your liver. So I would actually start by making sure that my liver is supported by milk thistle and schisandra. And I'd make sure that I don't have a viral problem that could be leading to some, liver issues that you're not producing your cholesterol. I suspect this person is not taking a statin drug. But there's got to be some liver issues because the vast majority of your cholesterol, 2/3 is produced by your liver. 1/3 can be done by, some diet and exercise. And if you're plant-based, you might have to go a little bit more of some meat process in order to do it. Okay, what we got next?
I think I'm experiencing arthritis in my upper legs and joints and hands.
I think I'm experiencing arthritis in the upper joints and legs.
Upper legs and joints and
upper
hands.
legs and joints and hands.
What can help?
What can help? Well, let's come back to this. Arthritis can be in any joint of the body, from your fingers, the only D, vitamin D, vitamin D, vitamin D, vitamin D. Let me say again, vitamin D, to help regulate the immune response. Because remember, arthritis is an inflammatory response, which is okay. Remember, your body's always trying to repair through the inflammatory process, but over time there can be degenerative. And that's why when you first look at the inflammatory process, if I smash my finger, I don't want to slow the inflammatory process down. I want my body's immune system to respond, bring blood flow, bring immune responses there, bring amino acids and other tissues there to regenerate and repair. But it should go in there, do its job, and get out. If there's consistent damage and consistent irritation, then it can end up being chronic, it can be more degenerative. So therefore, I would want a person to start on some turmeric and also on some boswellia and also vitamin D being first.
Please advise with coffee on an empty stomach. Before a nutrient breakfast.
Great.
And so she's wondering if are there any concerns with having
No, I have no
coffee?
concern that drinking coffee in an empty stomach. No, coffee in the stomach, you'd be fine.
Young man.
You might be a blood sugar issue, which will force a little bit of aromatase towards estrogens and also towards DHT. It's going to make his testosterone levels not maintain a good level. I would start that on a very strict carnivore diet for 2 weeks, then add fiber back in. And then I would actually look at doing zinc, tribulus, and also maintain that blood sugar very low to actually help androgens change. Okay?
My hands go numb when I sleep
My hands
without
go numb when I
leaning
sleep.
on
That means you have a neck problem.
without leaning on them. What's
Yep.
the cause and
That pillow that you buy, sleep with that. There's really good postural pillows out there and stuff like that. Sugar cravings at night versus in the morning or midday. Here's what happens. Let's start here. When you look at sugar cravings, blood sugar fluctuates. It's supposed to, once again, sometimes peak in the morning due to cortisol levels, okay? I know it's really funny. I always say this. If you ever want to picture a woman that's stressed out, okay, a woman that's stressed out, let me ask you a question. Do they crave an organic salad or do they crave something sweet? So whenever there's a high demand, a body's in fight or flight, you by nature crave a little bit more sugar. It's very difficult to not crave sugar. I know there's going to be someone out there that says, I don't crave sugar, I crave salt. Well, because one of the best fuel sources for our bodies, for certain organs, is glucose, including for the brain. That's why when everybody's like, no sugar, no sugar. Now, what I know that they should really say, and I say it myself, we do a no sugar challenge, you still don't avoid all your carbohydrates and things like that. What you're doing is you're trying to drop the glycemic effect down so you're not having high spike blood sugar for a long period of time. And you can actually legitimately look at this going, all right, if we can maintain more of a protein, because sugars burn quickly like kindling on a fire. Proteins, once again, are like logs. They don't cause a big fluctuation in your blood sugar. So be able to maintain a decent blood sugar through the day. Now, once again, just by circadian rhythms, you're going to get up in the morning. You're going to have a little bit of a craving towards sugar. That's why a lot of people want to eat. That's why a lot of people, even crave their sugary coffee drink that way. So now there happens this, and then all of a sudden, if all of a sudden their cortisol levels tank, your body's it'll start mobilizing sugar to drive that up, and therefore can lead to a craving. Vice versa. A lot of people at nighttime, if everything this way, I will make a statement. I'm not saying this is backed by a lot of research, but I think most people from a calorie and a sugar intake really gain weight from 6 p.m. to 10 p.m. due to the fact of just sugar cravings, emotions, boredom, things like that. And that can lead to blood sugar issues, that can lead to patients that have cravings. Ever see get rid of sugar cravings is death. Okay? What's next?
What are the immediate things you would do or changes you would
Right?
make
What are the immediate things you do or changes you make
if you or a loved one received a cancer diagnosis?
if you or a loved one received a cancer diagnosis? Okay, boy, you were putting me on the spot here. It'd be very easy for me as far as they would just go see Nicole. Daily, I get to see, people go see Nicole when their current cancer treatments have not worked. And so they end up in offices like this. And so therefore, you got to make a choice between, if something happens, I tell people, I don't look at this or that. I have no problem somebody choosing whatever care they want. There's consequences to all care. There's consequences to chemo, consequences there, radiation, there's consequences to surgery, there's consequences to IV vitamin C, there's consequences to everything. But you asked me what I would do, or if it was a loved one for me. This is for me. I'm not giving any advice when it comes to cancer that way. What I mean is it's quite scary if you look at statistics when it comes to cancer. It really is. Just even this alone, there's so much manipulation when it comes to reporting stats. If you're diagnosed with breast cancer, go through therapy, survive 5 years, and then die 5 years, 6 months, you're still listed as a cancer survivor. And that's manipulated as stats. I just don't like that. So I don't trust big pharma. I never have, never will. I've seen too much corruption. All right, we got next.
Are the toxin removing ionic foot baths any good?
Are the toxin removing ionic foot baths good? I think they have a benefit. I think most therapies have some benefit. Do I think that with any therapy Everybody over exaggerates. Yeah. I can honestly tell you, in 26 years of practice, I've never overpromised, exaggerated, or any kind of results that way. The only thing I can tell you this. If you clean up your diet, get rid of ultra processed food, start taking a form of vitamin D to make sure that you have decent levels, get really good sleep, keep your stress down, your life will be better. Will it be perfect? No. Can you see a lot of things change? Yes. And in my whole career, I've never looked at somebody, here, not a joke, this is gonna sound, and this is what separates me and my company from everybody else. People say, Doc, can you help? My answer is no. Is no. I even teach my students and my doctors that if you tell somebody that you can help them, you've just lied to them. Because what help means is you're gonna do something to them and everything's gonna be okay. That's not true. If you do your part and I do my part, I can see a better future for both of us. But if you have, cancer and you decide to keep your vitamin D levels low and eat sugar like crazy and not sleep and do all the bad stuff, man, I don't care what therapy you do, it's probably gonna be a bad day for you. So there's an element of both people, there's both people doing things to make things get better. All right, we got one more minute. What do we got left? Dr. Allen, what you got?
I got a question about macular degeneration, what to do to help that.
Macular degeneration? Okay, once again, let's start with there. Blood sugar issues. Blood sugar issues. Need more fatty acids. Blood sugar issues. I would say right now, and that's why we do our no sugar challenge. You'll still see carbohydrates on our no sugar challenge. They're just very low glycemic. Most people have blood sugar issues. They really do. It's why, you see the fight for diabetes. You see what it takes to just even have insulin. It's a huge part of metabolic syndrome and cancer and diabetes. It makes every condition worse. And that's why if you ever look at a lot of countries spend a portion of their GDP just on, we need to keep them down. And we keep them down by going more carnivorous, having lots of good fiber, and keeping very good fiber-based fruits and carbohydrates. You can eat sauerkraut like crazy. You're not going to get a blood sugar issue. You can have some very good fiber-based fruits and not have a blood sugar issue. And I know I watch people tear on fruits. I'm like going, no, I get what you say when you want to just go carnivore, but the properties of good berries and non-berries that are decent. It's just that once again, you got to get your blood sugar under control. So, yep. All right, guys, great live. We'll see you guys tomorrow. Remember, California Poppy is the herb of the day. Go to wellnessway.com. And remember, this Saturday, I'll be continuing my series on blood sugar, heart disease and statins. And thank you for all that. We had thousands and thousands of people on Saturday. Remember, we'll be giving $25,000 away of gifts on Saturday. Again, but you have to be live. You cannot phone a friend in this one. You got to be live that way. All right, guys, we'll see you guys tomorrow for a nice another live episode. We'll see you tomorrow. All right. Great job, everybody. Great questions by everybody.